Dental healthcare is one of the most expensive medical procedures globally. In Kenya, dental care costs mainly depend on whether you're visiting a public or private dentist and your mode of payment.
Dental treatment is relatively expensive considering our setup, being a third world country. The payment is two modes. Either they pay by cash or they pay through an insurer. So when it comes to an insurer, they pay for services that restore the main functions, which is eating, right? They pay for a disease process, majorly cavities or gum issue, right? Or surgeries. But when it comes to services that are to improve your smile, what you call cosmetic, insurances pull off, right? Or pull out from those services. So insurance would pay for an extraction, it would pay for a filling, it would pay for a root canal treatment, right? It would pay for the surgical removal of wisdom teeth, but it will not pay for bleaching, it will not pay for crowns and veneers to whiten, and it will not pay for braces, unless it's a very high level insurances, which we find with international companies.
Kenya is witnessing a growth in cosmetic dentistry. Boosted by higher disposable income, patients' demands have developed beyond simple mouth hygiene to elaborate beauty enhancement. One of the big current trends is the removal of stains. Stains, which are categorized under cosmetic dentistry, are of two types, internal and external. Removal of external stains at hospitals such as Mama Lucy Kibaki and Thika Level 5 or at any mid-level mission hospital like Sekijabe will cost between 3,000 and 5,000 shillings. Fixing internal stains might require bleaching, and this costs a pretty penny.
Bleaching is costly, all right? You will not get it in a public hospital. You may not even get it in a mission hospital. So mostly private providers are the ones who give bleaching. It is about 20,000, all right? 20 to 30, but give an average of 20, 25,000.
For moderate to severe stains, the teeth need to be covered by veneers. These are categorized into two: direct, which are applied directly to your teeth, and indirect veneers, which are fabricated outside the mouth by a lab technologist and then applied by the dentist to the teeth.
The direct veneers that we do on the chair, we generally call that procedure masking. It is a coat, all right? It is a special form of polycarbon that you prepare the tooth, you coat the tooth, all right? Then you dry it with UV light, all right, on the chair. It can range between, again, 2,000 in a public hospital, 3,000 probably in a mission hospital to 3,500, and 4,000 all the way to around 8,000 in a private clinic. Indirect veneer are made of porcelain, and now we have come up with special materials called zirconia, because you'll find a veneer probably 25,000 to 30,000 per tooth. So that gets away from an average Kenyan.
Cost of implants is beyond the reach of an average Kenyan. Single implants cost between 90,000 and 150,000 shillings. As an alternative, one could opt for dentures or bridges, which are relatively affordable, as replacing a single tooth with a denture costs only about 2,000 shillings.
I have a responsibility to tell people that you can get dentures from a public hospital. A single tooth is probably 2,000 shillings. 3 teeth, 3,000, 3,500. If it is complete denture, meaning you don't have a single tooth, you can pay as much as 80,000 in a private hospital. But if you walk to Kenyatta Hospital or University of Nairobi Dental Hospital or Thika Level 5 or Nyeri or Kiambu, you'll have that denture at 6,000.
Dental healthcare in Kenya remains relatively costly due to advancements in technology and expensive dental machines used. However, compared to other countries, the dentistry cost in Kenya is lower, and this has resulted in growth of dental tourism.
It is easier to do your dental treatment here than do it there. There, in some countries, especially the US, it is ridiculously expensive. So in terms of technology, the world has become a global village, and we are finding ourselves, it may not be distributed in all clinics, but there is no technology in dentistry that is in any country that is not here.
Despite the advancement in technology and the reducing cost of dental procedures, it is advisable to be keen on individual oral care, plus to ensure that you visit a dentist regularly.
Most important is brushing 2 times every day without fail, and avoiding detrimental habits like smoking, right? Taking a lot of black tea every day, black coffee every day, right? Other things that can stain like turmeric, a lot of spicy food, often can stain them. Lipstick, once in a while is fine. But if being overzealous, that again stains the direct veneer.